All right, welcome everyone. We're going to go ahead and get started with the recording. We appreciate you being with us here today. With all the conflicting information from so many sources, we understand that it can be confusing to seek healthcare in the wake of this pandemic. Please know that we have implemented enhanced precautions to keep both you and your loved ones safe. And we're going to talk about some of those precautions today. And so much more. We've assembled a great team of healthcare experts to join us today. First is Dr. Stanton Bailey, OBGYN. Thanks for joining us, Dr. Bailey.
Well, thanks for having me here today.
Yeah. Next is Dr. Ashley Crum. She's an emergency room physician as well as the ER director, medical director here at Brigham City Community Hospital. How are you doing today, Dr. Crum?
Doing great. Thanks for having me.
Great. And our third participant is Dr. Derek Walker. He's a general surgeon as well as the chief medical officer for Brigham City Community Hospital. Thanks for joining us, Dr. Walker.
Thanks for having me. Glad to be here.
Great. Also on the call, we have Jim Kirsting. He's our technical analyst. He's helping us get our first virtual experience off the ground. So thanks for joining us, Jim. So let's go ahead and get started. Thank you to everyone who submitted questions ahead of time. We really appreciate it. Our first question for the panel, Dr. Walker, what is important for the public to keep in mind concerning COVID-19 and the spread of it now that many businesses have reopened?
Well, I think the best thing we can do is not be lackadaisical while waiting for a vaccine. And what I mean is this, right? So wearing our mask, I think that's the biggest thing. If we can not remember, or if we can remember one thing, is to wear a mask. Of course, we all know about the social distancing and avoiding the crowds. Interesting, in Japan on the 9th of July, Japan has 126 million people. They had 197 new cases. And here in Utah on that day, that was one of our high days, we had 850. And I think the big reason is because we're being lackadaisical. So avoid large gatherings, limit our social bubble to, and it's hard when we have extended family so close by, but limiting that, doing some Zoom interaction with family members is okay to do. And of course, good hand hygiene.
Great. Yeah, thank you. Next question is for you, Dr. Crum. This person said, I'm nervous about going to the ER during the pandemic. Is there anything I can do from home to prevent a heart attack? And on that note, what symptoms do require an ER visit?
This is a great question. I think a lot of people are nervous about going to the ER during a pandemic. And the main ways to prevent a heart attack include eating a healthy diet, being physically active, avoiding smoke or secondhand smoke, taming your stress, which we can talk about a little bit more, and controlling your risk factors, such as high blood pressure, high cholesterol, and diabetes. I want to go back to taming your stress because during this pandemic, there's a lot of uncertainty. We don't know how long this is going to go on for. We've never been in this situation. And so people's stress levels are increased, and we're seeing that at doctor's visits and in the emergency department. And being able to tame your stress is a great way to prevent having something bad happen. And one way to do that goes back to being physically active, trying to get outside, trying to find ways that help you relieve stress in a healthy way. And so those are some things that you can do to prevent a heart attack. If you do start feeling concerning symptoms, we want to see you in the ER. Some symptoms that you should think about coming to the ER for include chest discomfort, and that can be chest pain or just not feeling right in your chest. Discomfort in other areas of your body, such as your upper arms, your neck, your jaw, or even sometimes into your upper stomach. Shortness of breath is also a concerning symptom, and that can be maybe from the virus, but it can also be because something's going on with your heart. Sweating for unknown reasons, nausea, or lightheadedness, usually in conjunction with one of these other symptoms, is also a concerning thing. And you should think about why or what these symptoms are. If you feel that you're having some symptoms that might be a heart attack, you should not waste any time in getting to the emergency department. And the fastest way to get there is by calling 911. EMS can get there quickly and start providing you care even before you get to the ER. As we say, time is heart muscle. So if you're having a heart attack, every minute counts, and these can help you decrease the risk of damage to your heart the quicker that we can take care of you.
Great, thank you. Dr. Bailey, women want to know, will I be required to wear a mask during my labor and delivery?
That's a great question because so many people are kind of worried about that right now. When you're pregnant anyway, it's already kind of hard to breathe just because of the hormones and that baby inside your tummy. But no, it's really been interesting on labor and delivery, both at the Brigham Hospital and in the hospitals in Ogden and in Tremont. I've delivered babies in all of those areas, and really nothing significantly has changed on the patient side of things. You do not have to wear a mask while you're in labor, thank goodness. I can't imagine having to try to do that. And also, whoever comes in with you while you're having your baby, they don't have to wear a mask either. It's important to know that we are trying to keep a very safe environment for not only the patient in labor, but the other people who are on labor and delivery. So even though you don't have to wear a mask, all of the healthcare providers are going to be masked to make sure that we don't give anything to you or your newborn. We do quite a bit of testing for anybody who's scheduled to have a C-section or wants to do an induction of labor. We test them a couple of days before we do it just to make sure that they don't have COVID-19. But otherwise, that's not a big significant difference on labor and delivery. We have changed things a little bit just because, like Dr. Walker said, we do want to kind of decrease our bubble and the people that we interact with. So we ask that you only bring one person with you while you are in labor. And that can really be anybody you prefer. It can be your husband, it could be your mother, it could be your sister, your boyfriend, whoever you want as the person with you. We also realize that a lot of women like to have doula support during their labors, and we of course allow any doula that you would like to have also come with you during labor. Other than that, most of my patients who've had babies, they really say the only difference is they don't get to see my beautiful face during the labor.
Great, good to know. Thank you. Dr. Walker, this question says, I was supposed to have knee surgery when this all hit and my surgery was canceled. When will it be safe to have an elective surgery again?
Yeah, it's safe now. And in fact, we've been doing elective cases since mid-April or end of April, excuse me, when the state reopened that. Again, we're following state CDC guidelines, or the state epidemiologist guidelines and the CDC guidelines. So what does that entail? Dr. Bailey alluded to it. We do COVID test all elective patients now, and that's 48 hours prior minimum. And then we do ask you to kind of self-quarantine until your procedure. Again, limiting exposure. Let's say a COVID positive patient came through our ER and needed emergent surgery. Well, we have protocols in place to take care of this patient, from intubation protocols to terminal cleaning after the patient has been treated. So all measures are in place so we can have safe elective surgery, as well as continue to perform the important urgent or emergent procedures.
Good, thank you. Next question for you, Dr. Crum. Am I at a higher risk for COVID-19 if I have a history of heart disease?
Okay, yeah, thank you, Nathan. So that is a good question as well. COVID-19 is a respiratory disease, meaning it mostly affects the lungs. But when the lungs aren't working at full steam or properly, the heart has to do more work to pump the oxygen rich blood around your body. That added stress can be dangerous for people with heart disease. We have also seen that the virus itself can affect the heart and causing different problems with the heart, as well as many organs in the body. So, having an underlying heart condition can put even more stress on your heart if you do end up experiencing this virus. And so, it's really important that you're keeping yourself safe, as Dr. Walker has talked about previously, and trying not to be exposed if you can, and understanding that you are at a little bit higher risk for possible complications related to COVID if you do get this, and having close connections with your doctors and being able to understand when to go to the emergency department will be important things for you to understand as this pandemic continues.
Great, thank you. Dr. Bailey, back to you. I'm sure that a lot of women probably didn't plan on giving birth during a pandemic. So what advice do you have for these women who are excited to give birth, even though we're in the middle of a pandemic?
Yeah. Pregnancy is a time where your immune system is actually kind of modulated down, turned down. There's a bunch of different reasons for that, but mostly, and as any pregnant woman could tell you, any cold that's out there, the flu, any kind of infection, women who are pregnant are more prone to pick those up. So your immune system is definitely not at its best while you're pregnant. Because of this, you really do need to make a couple of changes while you're pregnant. I tell all of my patients that they really need to try to, like we're saying, limit, your social interactions with people. Try to stay away from large crowds. Wear a mask and make sure that others around you, when you're interacting with them, are wearing masks, especially people who aren't in your household. Um, Other than that, there haven't been a lot of big changes in things we do. Uh, the biggest thing is trying to stay free of areas that would have COVID in it. I tell my patients to kind of um, change their plans before birth a little bit to try to social distance themselves, and also after birth, because right now we're kind of finding that infants, and the information is changing. Honestly, we could tell you next month that everything is completely different than what we expected. We were just talking today, my partner and I, Dr. Brown, how at first they said masks don't work. And now we're actually seeing just huge studies showing how effective masks are. And the people around you and you should be wearing masks. So things could change. But right now, babies who don't get COVID don't look like they're doing very well. So we really want you to kind of plan ahead. Um, After you've had your baby, you really want to keep that baby at home and away from a lot of the parents. And when I say not the parents of the baby, but your parents or other family who might want to come and see them. I mean, what an amazing world that we live in, that we can do this thing like we're doing right now. I mean, it's really nice that you can have family visit with your baby. Just do it this way instead. And I really think with that, hopefully, as this pandemic gets better and better, we'll be able to loosen those restrictions. But for right now, do make plans both before the baby to try to keep yourself safe and after.
Great advice. Thank you. Dr. Walker, we have a question. Am I more likely to be exposed to COVID-19 at a healthcare facility than at other locations?
Yeah, that's an interesting question. You would think hospitals, they got lots of sick people, you got to have a lot of germs, right? So actually, I would say no. The hospital is probably the safest place to be, and that's because of the precautions that we take here. I mean, we have great housekeeping staff. You can ask any of the doctors, Dr. Bailey, Dr. Crum. And we have people cleaning left and right. It seems like all day long. So I wouldn't say you could eat off the floor, but probably pretty close. But anyway, We have screening at one entrance, which is huge. Everyone then has to wear a mask. We talked about the enhanced cleaning protocols. So yeah, it's really safe.
Great, thank you. Dr. Crum, this one's for you. I heard that I shouldn't overburden the system with a little ER visit. Is that true?
That is not true. We want you to come to the ER if you need to be seen. We actually saw a very concerning trend when this pandemic started where people stopped coming to the ER, a big majority of patients for several weeks, which was very concerning to us because we're used to seeing a typical level of people with strokes and heart attacks and problems related to chronic conditions and other emergencies. And this completely dropped off, which made us wonder where these people were and if they were suffering at home and not seeking the care that they needed. So please do not delay care. We don't want you to sit at home and get more ill or feel worse and feel like you can't go anywhere because you're worried about getting the virus. As Dr. Walker just told us, we do a great job of keeping the hospital safe and clean, and we're the experts in how to prevent people from getting infections because we do this day in and day out. It's a super safe place to get your care. And if you have a problem that you would normally consider coming to the ER for, please do not hesitate to come to the ER. I will tell you, I've had many patients, even now, say to me, I tried not to come. I'm worried about it. I didn't want to be here. And there are people who are very sick and end up needing significant care. And we want to see you before it gets too late.
Great, thank you. Dr. Bailey, I know you kind of touched on this a little bit earlier, but people want to know if COVID-19 can be passed from a mom to a newborn. They're also wondering about breastfeeding.
Got it. So right now, it looks like there is no vertical transmission. What that means is if a mother gets sick, it does not cross through the blood through the placenta into the baby. So the baby's protected. And breastfeeding right now looks completely safe and compatible with if the mother does get COVID. But the number one way most kids get sick is from their parents. And so we certainly advise all of our new parents, I feel like a broken record here a little bit, but to try to stay safe, especially with that newborn at home, and try to limit the number of people who come see the baby. I kind of wanted to piggyback onto what Dr. Crum said a little bit. I've seen not a huge number, but quite a few people who have delayed coming to see us for one reason or another. I think of a recent case where a woman was having very heavy bleeding and he just kind of put it off because she was concerned about coming in and getting seen, and really put it off to the point where she was so anemic that she really got into trouble. And I think had she come in sooner, she would have had a much better outcome. I saw another woman who had a tubal pregnancy, who was having the problems, but kind of felt like, oh, I don't want to bug them. I know they're really busy, and kind of delayed coming in. Everything turned out okay for her, but I think again she could have had a much better outcome had she tried to get in a little bit earlier. The other thing women are very worried about, that they've heard that their babies are taken away from them the minute the baby's born. And unfortunately, that is true if the mother has an active COVID infection. When she gives birth, she would almost undoubtedly pass that on to the newborn, who is completely unprotected for it. And it's always the parent's choice. If they chose not to do it, they wouldn't have to. But they do suggest that if a mother has active COVID when she delivers the baby, that the baby be cared for by somebody else for probably 14 to even as many as 21 days until the mother's better, so that she doesn't infect the baby. I mean, that's the suggestion. I've never seen it personally, and I've never even heard of somebody who's had to actually go that big of a measure to protect the baby so far.
Oh, interesting. Thank you. Dr. Walker, surgery question. People want to know if their recovery will be different. Are they more likely to catch COVID-19 if they're recovering from a surgery?
Yeah, I mean, that's an important question. Whenever we talk to patients about surgery, we're going to talk about risk, we're going to talk about benefits and alternatives. And even before COVID, we were always very cautious. If someone had an upper respiratory infection or even a budding pneumonia, we wouldn't do surgery. We would postpone surgery so that they would have the optimum chance to heal. So this applies to our current situation. That's why we test for COVID. If they're positive, we don't want to do the surgery. So if you're healthy, if your COVID test is negative, then your recovery will be the same. Meaning you're going to have your restrictions from the surgery, whether that be lifting, and we'll go over the wound care. But one thing to note is when you are healthy, and part of surgery, part of this healing process is a good inflammatory process, meaning circulation of immune cells through the area to help promote healing is a good thing. And in a sense, it can be somewhat protective to you as well, as long as you're healthy going in. So I've had patients that we've operated on for elective surgery since it's opened back up. And again, like Dr. Bailey had mentioned, they might have delayed when they should have come in sooner, and they're grateful they were able to get their surgery done, and they're feeling a heck of a lot better. But again, they're healthy going in. So.
Good. Thank you. Dr. Crum, what additional precautions should be taken when a person from the vulnerable population lives with someone who's working in the general public?
So this is another really important question to address because many of our patients are in this predicament where they have one person at least who needs to go out and work and be out in public, and another person who might be very vulnerable, or several. I've talked to many patients that live or have grandparents living with them or parents that have health conditions, and they're all very worried about this. So the first thing I'll say is just going down to the basics, good hand hygiene and good hygiene in general. This doesn't stop when we get to our own homes. We should be washing our hands before meals, after we use the restroom, and if our hands get soiled in any way. We should also be trying to keep ourselves clean and do all of those kind of basic things we've been taught and how to take care of ourselves. Also, regular cleaning of your home can help prevent spread of infection. There's many disinfectants that we know are proven to work against COVID-19 and other viruses and bacteria. We should continue to use those. And when areas are soiled or if there is any concern, the house should be cleaned on a regular basis. It's also still appropriate to social distance at home. And I know that seems like a funny thing to say, but we know that this virus is much more likely to spread when we have prolonged close contact with somebody who has it. And so if you're with somebody at your house that you're concerned about and or a vulnerable population, trying to do some types of social distancing at home is a good idea, especially if you're having a surge in your area or if you're at a place where there's been an outbreak at your work. That's a good reason to do some social distancing even at home. And if you can't, like we've been counseling in public, a mask is an appropriate thing to use. And just an example of this, we've been doing this for a long time. People who have cancer or have other conditions that compromise their immune system, their family and friends will wear masks around them and or social distance, even though that may not have been what we were calling it in the past, to keep them safe because they are vulnerable during certain times in their treatments and in their disease processes. Another thing that you can do is watch closely for any symptoms that you might develop and make sure that if you do, you're seeking testing and treatment early in your case, and that you're limiting your contact with other people so that we're not spreading this around before we've gotten really sick. The person who is going to work in public should also be vigilant about reducing their risk of getting the disease and continue to try to minimize contact with others and only have essential interactions at work. One thing that is important as we go forward for our public health and for the health of our families is that we know who we've been in contact with should we contract this illness. and that we're able to help keep other people from getting ill or help them know earlier that they might have a chance of getting this.
Thank you. Dr. Bailey, I know you kind of touched on this earlier, but we had a question come in. She says, delivering a baby is a very special moment as a mom. I'm worried that delivering during a pandemic may ruin that experience for me.
Yeah, I completely understand people being worried about that. And it is. I mean, if you think about the most exciting times in your life and the things, the truly great happenings in your life, birth is one of them. And this does affect it. I would love to say, oh, absolutely no change. Really, the only change that you will notice at all is just the people that you can bring with you. I delivered a baby, gosh, I want to say about a week ago, and it was their last baby. And all the kids, they had teenage kids and younger kids, and they were all so excited to see the baby, and they just couldn't come in and see it. But one thing that is allowed, and most of our rooms have windows in them, and the family actually came out to the window outside, and we're all just peeking through the window with the baby inside. So I think that still made amazing special memories for the whole family. But in truth, other than visitation, there's really no significant difference in having a baby right now.
Great, thank you. Dr. Walker, we got this question. So, is the hospital fully open? And what services, if any, are still on hold?
Yep, we are fully open. So it might look a little different, having to come into one door, but again, this is for protection of the patients in the hospital and for you. So again, having the screening restrictions, the visitor restrictions, Dr. Bailey's alluded to it, and Dr. Crum as well. It's the same as for any inpatient visitors. It's just one at a time. After that person leaves, another one can come in. So we're not trying to limit who can see it, but again, just one at a time. But we want to make sure this is a safe environment in which you can receive care, and this hospital's done a great job setting that up.
Great. Dr. Crum, we're going to shift to you. What symptoms warrant a doctor visit?
Okay, so I took this question a couple different ways, so I'll give what answers I think might be being sought after here. So first of all, it's really important during a pandemic, especially, that you're taking care of yourself and being as healthy as you can, because we know that helps us fight off any kind of virus. And so you should go to your doctor's visit to maintain your health. You should not be missing your regularly scheduled doctor's visits or vaccines or anything that you might be due for, because these things will help you. And all of the doctor's offices, and including our hospital, are taking every precaution. So you will be safe when you go. But what we don't want you to do is to delay care. And so the main reason to go to a doctor right now is to make sure that you're keeping up on your health. You're getting your yearly labs done. You're making sure that your cholesterol and your diabetes or whatever you might have is in control, because we know that those put you at risk for having possible worse complications with COVID-19. If this question was wondering about what symptoms you have maybe with COVID that would warrant a doctor's visit, the main thing I'll say about that, and it goes for the doctor or coming into the hospital, is that if you are having difficulty breathing, you're unable to tolerate eating and drinking, so you're feeling dehydrated, if you're having chest pain or confusion or any concerning symptoms, you should be calling your doctor's office or getting into the emergency department to be evaluated as soon as you can. We want people to continue to feel comfortable coming and being safe and getting to a doctor, even if you're not sure about your symptoms. They'll do like the televisits over a screen such as this if you're scared about going in, and at least you can get an opinion from an expert, because that's what we're here for, and we want to take care of people and keep everyone safe. That's our job, and we're happy to do it.
Great, thank you. Dr. Walker, last question we got submitted. How can I be assured that it's safe to come to the hospital? What sorts of precautions are in place?
And yeah, I don't want to sound like a broken record, but the hospital has taken its recommendations from the CDC, which in the parent company of the Mountain Star Health Network is Hospital Corporation of America, a huge company that wants to make sure all the patients are safe and receiving quality care. So we start with screening, and that's not just screening for patients, it's screening for all employees, including physicians. So we all start there. Masks worn throughout the hospital. That's not an option. And again, that's the most important thing that we can be doing even outside the hospital. So again, I want to stress, don't be lackadaisical with the mask. Visitor restrictions, just one per patient. And then the enhanced cleaning protocols. So all these are great things that we're doing to make the hospital a safe place.
Great. Well, thank you all for joining us. I'm going to let you give us your final thoughts. We'll start with Dr. Crum, then Dr. Bailey, and we'll end with you, Dr. Walker.
Okay, so thanks so much for having me. And we're always happy to talk about these things because this is such a new situation that we're in right now. But I mainly want to reiterate that don't delay the care that you need. We are here for you. We're happy to take care of you. It is very safe to come into our emergency departments. They're taking out my garbage before I even put anything in it, and mopping and sweeping the floors every time I step on it, it feels like. So please come and seek care if you need it. And if you have questions or concerns, get in to see your doctor, or we're happy to see you. And thank you so much, Nathan.
Thank you. Dr. Bailey?
Oh, thank you. And again, thanks for having me today and letting me kind of speak with people here. I guess I just want everybody to know, all of the physicians who've spoken with you today, we're all part of this community too, and we're all in this together. It kind of stinks, and sometimes it seems like the world is never going to be the same, but it is going to be. And all of us are here and willing to help you with any needs that you have. And please come to us if you have any other needs. And again, thanks, Nathan, for having me here today.
Thank you. Dr. Walker, any final thoughts?
Well, I grew up here and I've watched this hospital transform over the years. I was away with my training in the Air Force and whatnot and worked at lots of hospitals, but this is a top-notch hospital. And as you've heard from the other physicians here today, it's a safe place to be, and you don't have to travel to have quality, safe health care. And let us take care of you locally. That's what we want to do. So, thanks for having us.
Great. Well, thank you to the three of you for joining us. Thank you to all the people watching right now. If you do have any more questions, please visit brighamcityhospital.com. We have a coronavirus hub. Just click on the banner at the top of the website. Thanks, guys.
Thank you.